Joining me now in the Health Hub is Dr. Amy Ray, Head of Infection Prevention at MetroHealth. Do you think it's dangerous for a medical office to require a patient to come in for a urine screen or blood work?
If you have concerns about being exposed to COVID while you're in a medical setting, then that should prompt a call to your physician or communication to your physician or provider before you arrive. But essentially, a conversation needs to happen there between you and your doctor, which carefully weighs the risks and the benefits of you coming in.
If you think you have the virus, what indicators make it serious enough to go to the hospital as opposed to treating it at home?
So the indicators for hospital stay should be if you are short of breath, if you feel like you're gasping for air, certainly if you have chest pain, if you're unable to maintain enough intake of fluids to remain hydrated. So if your urine becomes dark and you're feeling lightheaded, those could be signs that you're not adequately keeping up with your intake in terms of fluids and food.
What precautions do we need to take for delivery or pickup of groceries?
The interaction between you and the person dropping off your groceries should be so incredibly short. So this is not what I would consider an exposure, even if you're spending time with them. You'd have to be pretty close to them for at least several minutes, and that seems to me to be unlikely in that setting. And then the other piece of this is if they're leaving your groceries, the question then becomes, could you possibly contaminate your hands or your food from handling the bag or the contents of the bag? And that is very, very unlikely. This is a virus that doesn't like to survive for a long time on surfaces, but certainly after you're putting away groceries and before you're preparing food, hand hygiene would always be recommended.
Committed to bringing you facts, not fear. Monica Robbins, 3 News.